As we continue to highlight APHA's Women's Leadership Institute, today we are shifting to the social determinants of health, equity, and partnership. Here now is Shavon Arline-Bradley and Tekisha Dwan Everette. Thanks so much for joining us here today.
Thanks for having us.
So wonderful. Talk to me first off about, health inequities and everything, and about the importance.
Health inequities are really entrenched in what we've seen in our country. Challenges with racism, classism, gender discrimination, limited access to education, healthcare, those determinants that we keep talking about. The reality is, if you do not live in a safe space, if you do not have access to quality care, if you're not able to, in this country, be able to earn a living wage, then you may be in a population that will have challenges achieving equity. And so for the work that many of us do, I'm in civil rights, but I'm also a public health professional. Every day I realize that our fight is to change those systems to be able to create that optimal health experience.
Okay, and Tekisha, did you have some thoughts about this?
Sure. I think sometimes when we talk about racism, people think about, whether people individually like each other on a basis of skin color. This is beyond that. We're talking about the structural discrimination that has happened in our country that results in areas of concentrated poverty, that results in underutilized resources in communities. This is about systems and structure. It's not about individual behavior. It's beyond that. We don't care. Personally, I don't care if you like me because of my skin color or not. It really is about, do I have the best opportunity where I live, work, grow, and play to be the healthiest person I can be? That's what we're really talking about when we're saying health and equity.
And so what policies, are important to make sure that, we change that?
I think one of the places that I would land is, as a public health professional, looking at ways that appropriations fund public health work. And so as we're looking at long-term public health care and public health infrastructure, those kinds of policies are very important. I also want to say this, policies that are, some may surprise you, connected to opportunities for voting rights, access to equal pay. These are policies that I am following specifically as an NCNW president, because we know that if we have communities that have access to capital, access to housing, et cetera, looking at opportunities to be able to have access to vote, to identify those leaders that engage on public health practice, that is something that is a priority for us.
Yeah, Trust for America's Health, we really do care a lot about the public health infrastructure. Are we able to withstand the opportunities for public health that we can have to advance the public's health, and are we able to be resilient in the face of challenges such as the 2020 pandemic? And we know we're underfunded, under-resources in public health, but I also want to say it's not just public health strictly. When you think about public health, some people think about health departments, some people think about medicine. This is also about transportation, climate change. How are we addressing the challenges that we're seeing in our climate work? It's about obesity and how those rates are climbing, not because of individuals, but because of our structural disadvantages around access to health. So those are the things that we're saying when we're looking at policy. We know when you center equity in a policy decision, regardless of what it is, you're going to advance the public's health.
And so talk to me about the importance of having women of color, in leadership roles.
In general, the key thing is we have to have people who reflect those who have been disadvantaged in our society for a long time, and opportunities for leadership and places to actually influence decisions.
Yes.
So when you talk about why it's important to have people, women of color specifically, we are and see what's going on, and we can bring that viewpoint of how our lived experience has been and what the lived experiences are of our communities, of our aunties, of our grandmothers. We can all bring that to the table. So when we are able to be in positions where we can make those decisions, where we can influence those decisions, we give you a viewpoint that you otherwise would not have, and a connection to community that you just can't get without us.
When you're talking about women of color in leadership, you're also speaking to a population base that historically has not had an opportunity to be at certain tables. And that was by law, right? So what we're saying now is our country is changing. Our country's demographics are changing. And I want to, address the elephant in the room. It is not in spite of white populations. This is in addition to, right? This is where we talk about overall collective leadership that features women of color, that features black women, that features women who are mothers, right? Women who are living with a disability. Let's talk about all these experiences. And if we create more opportunities for black women, you will see policies change. You will see opportunities for infrastructures to change, because we've been trained and we've been able to experience those things in our overall communities.
And now y'all are also working on a project together. Talk to me about that project.
Good.
Yes. Yes. So you want to start?
Yeah, Good Health Wins is really an opportunity to advance something called a community of practice. And the Good Health Wins work is centered. It started really when COVID happened, and NCNW received a partnership grant with the Center for Disease Control. And we have leaders like Trust for America's Health, Vaccinate Your Family, and a massive network of our affiliates. So the Divine Nine is a member. We have the National Black Nurses Association, and also some of our states and local sections that are interested in integrating public health into your work. And I'm quite frankly excited about it because I believe this is a pilot for more opportunities to do more work.
Yes, Good Health Wins is an example of when we say, when you have people of color at the table, the conversation shifts. When we go back to the pandemic and looking at how the vaccination rates, first off, vaccine was not getting to populations, and the rates in people of color were not high. But when you have an opportunity like involving Good Health Wins, you see when you come to the table with a campaign that's for the people, by the people, the vaccination rates increased. People began to trust the vaccine.
Absolutely.
So we're really excited about this partnership because it is, like you said, a pilot of what's to come. When you involve the community in the conversation and trusted partners, we can change the world.
All right, I want to thank you all so much for talking to us today about these important policies and everything. So thank you again so much.
Thank you.